Hi everyone, welcome to this brief interview session. I've got with me Dr. Kaival Kothari. It's a proud moment for him. He has just got ranked 10 in this year's NEET SS examination, NEET super-speciality medical branch, of course. So, proud moment for you from all of us here at Marrow, and on behalf of everyone watching, a hearty congrats to you, Dr. Kaival.
Thank you, sir.
Yeah. So, before we begin, I would like to get to know you better. So can you just brief me about where you are from, where you did your UG, PG, and all of that?
I am from Ahmedabad. I did my
Okay,
UG and PG from BJ Medical College at Ahmedabad.
okay. And your DM, you are okay. Sorry. So you did your UG and PG from BGMC, is it?
Yes, sir.
Oh, good to know. So you are basically a native of Ahmedabad.
Yes, sir.
Okay. So I would like to know basic things like how long have you been preparing for your NEET SS? Is it your first attempt? When did you finish your MD? And
Uh, this was my first attempt. I completed my
Mhm.
MD in June 2023.
Okay.
So
Oh,
I was preparing for NEET side by side along with my preparations for my MD exam.
okay.
So since last 1.5 years, after our first year was completed, we started
Mhm.
preparing, and
Mhm.
I was preparing from Harrison and Marrow videos side by side.
Okay. Okay. So, preparing for the super specialty entrance was part of your MD preparation as well, is it? That's what you're trying to say. You did not
Yes,
have a separate preparation for the MCQ per se. It was part of your continuum.
yes, sir. So I watched many videos along with
Mhm.
along with reading Harrison during my
Okay.
MD days, and
Mhm.
after the MD exam, I focused more on the MCQs.
Okay. So, how much time did you have after the university examinations? You didn't have had much time, right?
No, sir. We had around. I started preparing 2.5 months before the exam.
Okay.
So that was when I focused more on MCQs.
Okay. So during your course, you were preparing using Marrow videos and with an eye on the
Yes,
MCQ part. And then once your universities were over, you concentrated fully on the MCQ. Is it?
yes, sir.
Okay. So I would like to know from your perspective, what were the challenges in preparing for an MCQ exam along with your residency period? Of course, I know BGMC is a very high volume center. It would have
Yes.
been tough for you to manage your thing. So what were the challenges and how did you go about it?
So we didn't get much time in the first year, and our
Mhm.
first year was extended to 19 months. So
COVID period, is
we
it?
yes, sir.
Okay.
So I started my preparation after that, but
Mhm.
because we saw a lot of patients, so we could remember a lot from seeing those patients,
Good,
and
good.
then it was just along with the ward duties, we would just read in the time that we get, and uh, read Harrison and watch Marrow videos side by side.
Oh,
So the
so if
same topic from Marrow video and Harrison.
oh, good. So if you're learning, say, cardiology from Harrison, you would
Yes,
once you read a particular topic, you will listen to that particular video from Marrow
yes.
as well. Oh, that
I
so
think
the whole
it
yeah.
complemented it well because reading Harrison usually takes a lot of time to understand
Mhm.
what they are trying to say. But after seeing the videos, it's you understand the concepts very well. So it's
Okay.
you read it faster.
So you basically couple them together as a single source, and you made your own
Yes.
notes or something like that.
Actually, I didn't get time to make the notes,
Make notes. Okay, I can imagine.
so
Yeah.
I would read the notes which were given in the app
Uh-huh.
below the video, and I would read
Okay.
Harrison, and then I would mark the part that I had to read from Harrison, the part that I had to read from Marrow. So while revising, I would read from both the sources. It it was a
Oh,
bit
that's nice.
cumbersome to read from both, but I did not get enough time to make notes to combine them both.
Okay, so you basically were relying on Harrison and you were relying equally on the notes on the app as well, right? So the
Yes, sir.
app notes on the Marrow app acted like your personal notes, so to say.
Yes, yes,
Oh, that's nice. Okay. And then I think you referred to the fact that you were seeing so many patients and that helped you in your preparation as well.
yes,
So I think that's got a very important lesson for everyone there. Even when you're doing your busy internship, people tend to think that seeing patients in the ward is one thing and preparing for an MDM exam is a different thing. But I think it's basically part of the same spectrum. That's what you're trying to say, right? I mean, at the end of the day, rather than what you learned in your textbooks, you might actually remember what you saw and did in your wards.
Yes, sir, definitely.
And how much were the exam pattern along those lines? Was it more rote learning type, or was it actually kind of more clinical scenarios and you could fall back on your clinical information? How much, what was the exam pattern like for you?
I think it had a bit of both.
Mm-hmm.
There were some clinical scenarios as well, and
Okay.
a few factual questions also.
Okay. It was a mix of both. Okay. Then did you prepare for the NEET as well this year, or did you have any specific specialty in mind?
Actually, sir, I am currently deciding between gastro and oncology.
Okay. Okay.
So my focus was mainly on NEET.
Neat. Okay. So you were not thinking of NEET during their preparation. You were primarily looking at the NEET pattern
Yes.
itself, and partly because it was Harrison based and it suited your internship anyway.
Yes.
Okay. Okay. So I would like to know which all areas you focus more. Of course, as part of your uh, MD university exams, you would have studied the whole of Harrison. I'd like to know two things. First, how much did you refer to any super specialty textbooks, or was it purely Harrison? Were you looking at any super specialty books as part of your thing? And number two, yeah, I mean, answer this, and we'll go to the next part. Yeah.
Okay, so I referred to Schlesinger for gastro, but for most of the other systems, I referred to
Mhm.
Harrison and the Marrow SS videos. So they covered
Okay.
a lot of SS content.
Okay. Okay, so you are relying on the faculty videos for the a little more higher points,
Yes.
so to speak. Something that was maybe I think from an oncology point of view, I can tell that there is very little things in Harrison basically from an onco point of view. It's quite a basic
Yes.
level information, especially for solid organ malignancy. So that's why I asked you. So how much
Yes.
yeah, okay. And number two, what was your breakup like? I'm quite curious about it, especially from a medical onco point of view. Oncology is not a very core part of your MD general medicine training, right? So even when I did MD medicine also, there was very few things in medical onco that you were actually seeing and dealing with as part of your MD medicine. Maybe there are the oncological emergencies you see. You would see hematology. You would see maybe CA lung, but you wouldn't be treating a breast cancer. You wouldn't be treating a gastric cancer as part of your MD general medicine thing. That's what I know from an oncology perspective. So I'm
Yes.
curious to know which all areas you focused on more. Of course, other than covering the whole of Harrison, you would have focused on a few areas.
Yes. So I used to give grant test every week, one
No.
grant test every week, and then
Okay.
after 3 or 4 grant tests, I would look at which areas are weak,
Oh,
which systems or which topics are weak, which I
hmm.
frequently get wrong, and then I would think whether I need to read the topic in more depth, or I need to revise it more often, or whether I need to practice MCQs from that topic more often. And based
Great.
on that,
Great.
I was in a way counting out of the wrong questions, how can I get more correct? So if I was
Okay.
getting
Okay.
35 questions wrong, then I would see how I can get 5 more correct. So for that, I would see which topics I can get with a minimum effort, how can I get more questions correct?
So
Because
you are
the course
basically
is,
introspecting as to why you got those questions wrong and what you could
yes,
have done to get it right.
yes.
Oh, that's nice. That's a good way of looking at it. Okay. So again, from when did you start giving your grant tests? From what point? Maybe second year, or maybe you covered almost your whole topic once, and then you got into solving this grant test, or from the beginning you were writing.
I started giving it from the beginning,
Okay.
since the last 2.5 months before the exam.
Okay.
Uh,
Oh, okay.
and
Only the last 2.5 months. Okay, fine, fine. Understand. Yeah. Yeah. Okay. So before that, you were not looking at the MCQs part. You were focusing on the theory and the videos.
I was doing a few MCQs here and there, but
Hmm.
not in a organized way or with proper planning. So when I used to get bored while reading, I would do a few
Hmm.
MCQs uh,
Okay.
in
Okay.
the last few months.
Okay. Okay. Excellent. I mean, your game plan is almost near perfect for someone who is doing an internship because you said you used your time in the ward in your as part of your ward works positively for your preparation, You did not compromise on the theory and the practical part. And then once that part was done with, you use the MCQs to try and go back and see how you can do your theory a little better. Maybe that's a perfect game plan for someone doing an internship. So, of course, I think very few people will be cracking SS at the end of the internship itself. So, as someone who has recently given the examination, and maybe, of course, you know your friends and seniors who could be preparing, dropping an year and sitting through for an year or two. So, what would you suggest to people who have probably taken off from work, who have not working and sitting at home, or maybe full time into preparations? How do you think they can space it out? How do you think they can go through? I mean, of course, it's tough for you to imagine being in their shoes, but then, since someone who has just given the exam recently, what do you feel?
I think what helped me was that we had a group of 6 to 7 friends. We used to study together in the library.
Okay. Okay.
So whenever if we were confused about how to go about a system, so we used to help each other a lot, and
Mm-hmm.
that helped a lot, all of us. So if you are studying, then you should study with other people. So
Mm-hmm.
that will help you also to keep going every day. And if you are going off track in your preparations, then they can help you a lot. And
Okay.
then
Okay.
you have to figure out your pattern. How many revisions do you need? How much MCQ practice you need, and how that you can fit that into your schedule. So you have to make a timetable, and then accordingly you have to divide and analyze at every month or so for those who are taking a drop. I guess.
Okay. So you mean to say there should be a continuous introspection at every point? That's what you try
Yes.
to say.
Yes.
Okay, so your method is to not finish the whole thing and then come back and see. You suggest that there should be periodic assessments of how you're doing, how much you
Yes.
remember, and if need be, maybe you should have a flexible plan. That's what you're trying to say.
Yes. Because there will
Excellent.
be few topics that you need to revise 5 to 6 times. Few
Correct.
topics that you only need to revise once or twice. So
Correct.
it's not possible to revise the entire syllabus that many times. So you have to pick which topics you are going to revise how many times at what
Hmm.
intervals for the exam.
Great. Great. So you basically say it should be a flexible plan. It should be a personalized plan as
Yes.
per what you feel better at and what you feel comfortable at. Excellent.
Yes.
Okay. Uh, One more thing, I'm again a little curious from a medical oncology perspective. How were the oncology questions for the NEET SS, and into how much depth were they going? Were they more general medicine based, or was it core oncology?
Uh, they did not go into too much depth in the solid malignancies.
Okay.
Uh, So there are one or two tough questions from leukemias, but
Hmm.
overall the questions were not too much in detail. But
Okay.
uh, you need to cover the whole thing. So there might be a question from inheritance, also a few questions from surveillance, a few
Okay.
questions about management. So
Okay. 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 You need to cover one particular topic from heading to this thing. It can be from anywhere. That's what you're trying to say.
yes,
But it was not into too much of depth. They were more at a
yes,
peripheral level.
yes,
Yeah, but hematology, I guess they went a little deeper, right? Leukemias and
yes,
the hematology part of it.
yes,
Okay, okay, okay. Sure. So now you are probably trying to decide between what to go ahead, right? What to take a medical gastro versus medical onco.
yes.
You don't have you have not made up your mind yet.
No, sir, I'm yet to decide.
Okay, okay. So nice talking to you. I think really congrats to you because it's not easy. You made it sound very easy, your game plan, because I've also gone through this a few years back. And I can imagine the kind of workload you would have had to go through in Ahmedabad. So I think, despite all that, your game plan sounds very simple, and I think that's the beauty of it. But I can imagine it would have been quite tough to execute this particular game plan with this periodic revisions, going back and balancing your residency duties and all of that. So hats off to you. It's a really proud moment. Make a very wise decision with regards to your specialty between medical gastro and oncology. So before we move on, I would like to ask you: do you have any specific feedback or any suggestions or anything to give for us here at Marrow so that we can also improve? And any honest feedback we'll be happy to have.
I really can't think of anything. It was very helpful to me. The videos, the MCQs, and the tape series as well. So it was all perfect for me.
Okay, sure. Good to hear that. So I hope that your story and your methods inspire a lot of aspirants going ahead. Mentor those who are coming after you. All the best and congrats once again. And thanks
Thank
for
you.
having that. Yeah, sure. Thank you.